talk more about COVID-19 because the number of cumulative COVID-19 cases of the Bono East Region since the outbreak of the pandemic stands at 845 with 15 deaths. Regional Health Director Dr. Fred Adomako-Boateng disclosed to Joy News' Anna Sabit that even though there has been improvement with regards to the adherence to the safety protocols, the region has inadequate facilities at the district levels to manage cases. There's more in the following report.
If you look at the COVID situation in Bono East, it's not entirely different from what we are seeing in the country. But nevertheless, our numbers are not comparable to what Accra and Kumasi are experiencing. Since November, the middle of November, the figure that we had was static, was there till the beginning of this, actually the second week in January. So you can see, and this is quite deviation from the first case that we referred last year, where we had one and it took about 2-3 weeks before we had the third and fourth. And if you really look at our graph, you can see it's beginning to rise. And we know at least once you see about 15-14 people, you can project the people who are exposed.
In terms of adherence to the safety protocols, Dr. Fred Adomako-Boateng tells me the situation has improved over the past few weeks.
The protocols, I must admit, is improving. It's really improving. Even among health workers, the places that have been, it's improving. But I think we really have to quantify. I think now people are getting it. But we are not where we want to be. The understanding is dawning on people that, look, COVID is really real and COVID kills. The young people can also get COVID now as compared to last year where people were doubtful in terms of what we were discussing. I must say that there is improvement. If cases are supposed to be managed in hospitals and we don't even have the hospitals, then obviously from the word go, you are already defeated. So that's one of our fears. Secondly, you see the way the cases are coming now as compared to initial cases. They are coming in huge numbers. And that's what we have to avoid. Because imagine that you have about 50 people at a go that you have to support them. So that you see that people start dying not because the virus is killing them. It's because we can't provide that support. And so we cannot afford to go there, one, because we don't have that level of expertise in Bono East. All our hospitals, with the exception of, let's say, Holy Family Teaching Hospital. So you can see by in the infrastructure and the skill that we have, we are at disadvantage.
He therefore encouraged the people to strictly adhere to the preventive protocols as prescribed by health authorities.
Because of you can have unnecessary death from mothers delivering. You can have unnecessary death from cardiac failure, emergency surgery, accidents. So you see all kind of vicious cycle that the COVID has put us into. So it's important as a region. Our main goal and target should be prevention.
Reporting for Joy News, Anna Sabit, Tichima.